our guests joining us from Stockholm is Johan Giesecke. He's a Swedish physician. He's also Professor Emeritus at the Karolinska Institute in Stockholm. And we have joining us from the U.S. Denis Nash, who's a distinguished professor of epidemiology at the City University of New York Graduate School of Public Health. Welcome to Al Jazeera. Thank you so much for speaking to us. So Johan, I'll start with you. While some nations are reimposing coronavirus restrictions, including lockdowns, in the face of this new variant, the Omicron variant, others, like Australia, for example, are loosening up. So even as the case numbers spike, are lockdowns effective or ineffective, in your opinion, in slowing down the spread of the coronavirus and Omicron?
Three things. Thank you for the question. Three things that I feel are important. The concept, lockdown, is not well defined. It means different things in different countries. That's one thing when you discuss it. The next thing is, how do you measure success of a lockdown policy? Is it doing any good, or is it just a problem? And the third thing, which I think is most important, that this pandemic is not over. We're discussing it in the midst of, like we heard in the previous show in the program. And the tables of deaths or cases between different countries are changing by the month. So it's difficult to
Okay, well, I hear what you're saying, that it might not be a one policy for all. But let me just ask you this before I move on to Denis Nash. Let's look at the case of Sweden, for example, where you are joining us from. Sweden's strategy from the very beginning of the pandemic, in fact, relied on individuals taking responsibility under what was called non-binding recommendations. But that itself was criticized internally by a Swedish commission, which said the government the response was late and insufficient, as numbers eventually did spike in Sweden. So what can you tell us about the Swedish experience that didn't go so well, perhaps?
Well, you're right. These restrictions have not been as binding and not law. They relied more on individuals taking responsibility for themselves and for others. We can see now that this policy has not been bad. If you look at the death tables for Europe, for example, Sweden is somewhere in the middle, not on top. So I think the Swedish approach has been quite effective. Thank you. Denis
Nash, welcome to Al Jazeera. What's your take on this? I mean, when you look at countries like, for example, China right now, or at least one area of China in the Northeast, I believe, it's announced that it's putting up to 12 million people under lockdown because of the new variant. To what extent do you think lockdowns help in slowing down the spread of the coronavirus?
Well, I mean, to be clear, they are very effective at slowing spread 100% of the time. The question is whether or not it's indicated. And in my view, there have been times in the past where it has been indicated, thinking about New York specifically in March of 2020 and April of 2020, when our healthcare systems were overwhelmed. But right now, we're in a very different place than we were in 2020, with vaccines covering a large proportion of the population. We do have a new variant, and it is causing unprecedented levels of community transmission and surges in cases here. But I'm not convinced that this is a time for a lockdown in New York. I think what we'll be looking for to make the decision about measures like lockdown include the extent to which it appears that the healthcare system will be overwhelmed with inability to treat new COVID cases and new other health emergencies that require urgent care. When it looks like that is about to happen, then I think we do need to be thinking about stricter measures. I guess I would also add that there are many, many other measures that should be on the table in a situation like ours before we go to lockdown.
What sorts of measures are those?
Yeah, so things like masking policies, things like social distancing, preventing mass gatherings. In New York City, for example, we have a New Year's Eve celebration that is planned for December 31st, where it's very traditional for many thousands of people to come from outside of New York City, from outside the U.S. even, to attend a gathering. And this, I think, is a bad idea at a time like we're in right now. And policies should dictate how those things happen, so that we can use other levers that we have to limit community spread before we have to be faced with a lockdown decision.
Right, but we are seeing some of these measures already in place, including the mask wearing, Denis, as well as the limiting on the number of people, and yet the numbers do seem to skyrocket, especially in New York.
Yeah, well, I think that there are masking policies, but we also have situations where it's very easy for the virus to spread. For example, we still allow indoor dining when we don't necessarily have a situation where this virus respects vaccines when it comes to its ability to spread. So there are many situations where there are no masks being worn where the virus can spread. And I think that's why we're seeing cases, including in households, right? It's very infectious, and people tend to not wear their masks in households, and maybe that's reasonable. But it's just to say that there are lots of other things that we can do before we get to the place of having to lock down.
Johan, what do you respond to?
I agree.
Yeah, go ahead.
I agree. Sorry, I agree with what Professor Nash is saying. There are other things that could be tried before we move to a real lockdown, whatever that is.
And let me ask you this, because there is some criticism by some people who say, well, you know, lockdowns are an infringement on people's freedoms, and that could be a slippery slope. Johan, what's your response to that?
Of course, it's a severe infringement on people's lives. I think we should be careful and watch out for the measures not taking individual liberties in danger. We have to watch out for that we are not slipping. That's a slippery slope, and the government deciding what you can do and cannot do.
Denis?
Yeah, I think we have, a view in public health, which is that it is a community responsibility in situations like pandemics. And of course, there are individual liberties. Our country in the United States is very strong-willed about this. But in the field of public health, we often say things like private privilege and individual liberties end where public peril begins. In other words, it's not okay for people to retain their individual liberties when it means that they may be putting other people in society in peril.
And Denis, let me ask you something that the World Health Organization has in fact stated, and that is about the direct impact that lockdowns can possibly have on a person's income as well as their mental health. This is what the WHO is saying. It's explaining that such measures can have a profound negative impact on individuals, communities, and societies, and it could disproportionately affect vulnerable groups. Have you seen any of that through your work?
Yes, 100%. We've been following a very large cohort of people around the U.S. That is looking not only at the COVID pandemic and how it spreads, but also how the measures that are being put in place are affecting people's economic outcomes, their mental health and well-being, many of these dimensions. And I agree that there is, major downsides of lockdown to some of these other outcomes that you mentioned. And this is the reason why it should be a last resort, really. We have so many other good tools that we should be leveraging so that the healthcare systems don't become overwhelmed. And we should be able to do that without lockdown. However, if we can't, then we have to have lockdown measures on the table. And by that, I mean restricting people's movement around the city and country where this is going on.
Okay, final word to Johan. Yeah, go ahead, Johan. I see you want to jump in there.
I agree. For the low-income countries, this is a disaster. That where you buy your dinner for the money you made during the day, this is not. It will create more disease, more problems with the lockdown than without one.
Okay, we'll leave it there. Thank you so much for speaking to us, Johan Giesecke from Sweden and Denis Nash from the US. Thank you so much.
Thank you.
Plenty more ahead on the